Let's go ahead and get started. This is a meeting of the Assembly Health Policy Committee. It is Wednesday, November 20, 2019. We're noticed from 12:30 to 1:30 p.m. Agendas, I believe, are back there on the table. Let's go ahead and start by identifying ourselves for the record.
Meg Zalatow.
Forrest Dunbar.
Felix Rivera.
Suzanne LaFrance.
Ruby Momsen.
Drew Shannon.
Natasha Pineda. Nicole Lebo. Chris Vaughn.
Carissa Clerksox.
And in the back.
Oh, my name is Kirsten. I'm a reporter of the Alaska Public Media. Donna Harris, I chair the Health and Human Services Commission.
Welcome. The man who needs no introduction.
For the record.
Did you go hide outside or something?
Do you need to go hide?
I said, did you go outside with them or what?
No. It's good to see you, Mr. Trainee. Thanks for coming. Just wanting to identify folks who are here and.
You should call him and represent myself.
Okay, well, welcome and thank you all for coming. Thank you to the Health Department. I understand you'll be presenting to us today on vaccine preventable diseases. We'll go ahead and turn to Ms. Pineda for a Health Department update.
First, I wanted to say thank you. The budget last night that was passed provides us with some resources that were sorely needed for a long time, and it's really appreciated. I'll just run through some highlights. We recently completed a comprehensive literature review of electronic cigarettes and vaping that we'll be making available to you hopefully by December. In the administration department, they're very busy as always. We just and are in the process of completing a new 5-year grant agreement with Providence Alaska Medical Center for the operations of the Sexual Assault Response Team Center, that they get annual funding from us. The grants and contracts teams processed after you guys approved the Human Services Community Matching Grant, so most of all those entities should have their resources now available to them. We are working currently on an amendment to the Brother Francis funding to allow them to spend some of that funding on security for evening hours because of the Human Services Community Matching Grants. That freed them up a little bit, so they're working on putting a contract in place shortly, I believe. So we just have to complete our internal amendment process to the funding. Do you guys have any questions about that?
Let us sink
Animal Care and Control received a court order to immediately release 2 dogs held in protective custody pending cruelty charges. The owner was acquitted of those charges and was awarded the opportunity to redeem her animals. That's something I know all of you have been kind of following and are aware of, so I just wanted to update you that that's moving forward. There are 2 Animal Control Advisory Boards coming up. A Title 17 committee meeting is on November 14th at 11:30 in our conference room at 423. The Animal Control Advisory Board, their full board meeting meets on December 5th at 5:30 at the Animal Control facility. Related to emergency preparedness, our team recently participated in the Alaska Dialysis Community Tabletop exercise. It provided us an opportunity to understand the dialysis community's preparedness and response plans to assist individuals in if we had another emergency. Our AP team also coordinated with Washington State Department of Health to receive air quality alert public messaging products available in 11 languages. And they are going to allow us to modify those products to use in Anchorage, which is going to save us thousands of dollars in translation services. And we'll also be better prepared for any messaging that needs to happen in the case that we have another summer like we had this past summer. So we're really happy about that. In child care licensing, they had 684 contacts with the public in the month of October, so that includes everything from inspections to walk-in clients, and an additional 421 emails. Those are individual contacts that come from the community to the general email box. They're very busy doing the business that they do. In community safety and development, as of November 2nd, we completed our drawdown of $1.75 million in HUD funds. Essentially, that allows us to stay in compliance to be at or below 1.5% of the allocated amounts that they give us. Those funds roll in 5-year increments, and we have every year there's a certain amount of money we have to spend or we can lose it in a future year. So we met our goal for the year, which was excellent. Last night, you guys saw on the agenda that we had the sole source contract for the project management services for the Alaska Center Treatment Project. I believe it gets approved in the next assembly meeting. And additionally, the next assembly meeting, you should see a substantial amendment that has completed the public comment process related to HUD funds. And so that should be in the pay system and making its way to you soon. Senior emergency outreach services, they provided over 100 referrals last month. As it relates to emergency sheltering, Beans Cafe had their soft opening on November 11th and had 100 beds available. I think by the 13th, they were fully operational. We had agreed that we were shooting for the 15th, but I think they got it done a little bit early. So they've been functioning, and I didn't look at last night's numbers, but for the time period between now and then, there was one night where they were at capacity, but the rest of the periods have been somewhere between 100 and 130 individuals who've used the service. So we're right where we want to be right now, and that's very, very nice to see that we have that space. Last year we ran into it where we just had an extra 20 or 30 people who didn't have shelter, so it was very stressful for everyone in the city trying to come up with a plan to address that. We're glad we have that.
Anita, we've got a question or
Oh, yeah.
comment from Mr. Rivera.
Thank you, Madam Chair. So, two things. First is, as you are aware, one of the amendments that we passed yesterday was around ACEs. And so I'm wondering if in this report that you give at this committee, if you can just give a regular update on that as you're moving forward with the RFP process.
Absolutely.
Thank you. And then the second thing is on HUD, and I know I ask this every time, and I understand why logistically it may not happen, but has the HAND Commission been able to weigh in on that?
Yeah, so with every product that we, whether it's the plan, the annual plan, or a substantial amendment, we always co-coordinate the public comment process with a HAND Commission meeting, and our staff the HAND Commission meeting. So they were there, and they walk through the public comment process, and they share the items with the HAND Commission. We have asked the HAND Commission to either email this body or send a letter letting them know what your thoughts are on it in anticipation of your question. Because I knew we would have it, and I appreciate it. It's we want to know what their thoughts are. So I'm going to try to meet with their chair and see if they can do it at that time and let us know what their thoughts are on it.
Thank you.
We're very aware that he would like that.
Thank you.
I believe they have a letter en route to you guys in response to your request about a report. We were just working out details on what's the right letterhead, how do they do that? Because it's not coming from us, it's coming from them. So we were just working out some of those internal details. I think.
I would say shortly.
Yeah. We'll route it as soon as we have it ready and signed.
I would also say that we've recently staffed up our main point of contact between the health department and that commission within the last 2 months, and have had now multiple meetings, one this week, about like how are we going to coordinate, and we want these types of letters and this type of communication from you, and so then there'll be a follow-up with this.
Yeah.
And so yeah, that should be forthcoming.
Okay, thank you.
Thank you, Mr. Rivera.
Let's see. Okay, emergency family shelter.
Sorry. Actually, we've got
Oh.
one more. Sorry.
Oh, maybe
Mr.
you're just about to
Dunbar?
get that. I'm sorry. So I missed something with the emergency shelter at Beans Cafe coming online. Is it just Beans Cafe, or are there other emergency shelters that have been stood up? And you said we still have some capacity. Is that at Beans specifically, or is that the whole system?
Yeah, I didn't look today, but I can look before the end of this meeting. But yesterday when I was looking at it, all of the shelters except for McKinnell and Hope had space. There was availability, so there's some little stretch right now at all of them. But that could change, a lot of times at the first part of the month, people don't need shelter as much as they need it for the last part of the month.
Can I ask a follow-up to that? So, okay, so what you just said is interesting. So, first part of the month, not as much as the last part of the month, presumably because they run out of money, right?
Yes, I
Leave their
think that's
apartment.
the trend.
So, what's the current count right now of people that are sheltered about? And do you have any other theories as to why it might be lower than we thought it was going to be?
I don't know that it's lower than we thought it would be at this point in time. I haven't looked at how many were there last year at the same time, but I can prepare that in the future. We go to the 150 because we know at periods throughout the winter there was a regular need for it.
Yeah.
And that's why we created that space. But I'm happy to next time have a
150 in
count.
addition to the 240
At Brother Francis, and there's
and then there's some other
52
gospel
at Hope.
others.
Yeah, 100. There's a variety. I didn't bring that, so I can't speak to it.
Sure.
Anything else, Mr. Dunbar? Thanks.
So for the family emergency shelter that is coordinated through the faith-based community, during the month of October they had 15 families access the church services, and that included 22 adults and 27 children. I do not believe they've been maxing out in the evening, so there's also capacity available. And that the same story as Dave Kuiper is the person to contact if there's a need. And 211 helps coordinate access as well. In the public health division, our flu campaign's been underway, and to date we've given 3,096 flu shots. So I think they've tripled the number of flu shots that they did last year, I think, or maybe even more. They've been really focused on that. We had an increase in funding from the state for the HIV grant, so we received an additional $50,000 that will be used to help us acquire a part-time PHN, or fund a part-time PHN. In environmental services, last month they had over 667 contacts with the public, including 182 kitchen inspections, pool inspections, plan reviews. They also distributed 166 high-quality bike locks and are continuing their work around promoting bike safety and biking to work and alternative modes of transportation. The WIC program is continuing to experience high volumes of program vacancies, and so we're hoping that in the near future that will be resolved with some of the changes we made in the budget yesterday. They're continuing to do lots of creative or new types of outreach, including working at Kids Core Head Start, coordinating partnerships with the Neighborhood Health Center. We're looking to co-locate some services there, continuing educational classes at Clare House and McKinnell houses with families, so that continues to go well. And we are still in the process of hiring a SNAP Ed nutrition educator, and that is my report.
Thank you, Ms. Benita. Any questions or comments from members? Okay, appreciate the update. You all are very busy.
It's pretty busy.
So that brings us to the second item on the agenda, follow-up regarding vaccine preventable disease.
Yes. So we have our team here who's going to be, all of us have a little bit of a different role in this presentation. So we have Drew Shannon, who's our public health nurse, myself, Nicole Lebo, Human Services Division Manager, and Willie Namchang, who will also be presenting. She's one of our supervisors in the community health nursing team. And then Chrissy Lawton is one of the supervisors as well. So we are here to do a brief overview of the services that we provide, just for those of you who weren't here in the past, discuss some of the things that we reviewed last year with a couple of updates, and then talk to you about our follow-up on the 4 recommendations that we had made to you last year. So this is just a reminder, we're charged with really focusing on the 10 essential public health services. So when we look at public issues or health issues, we use an assess, policy development, and assurance model. So we monitor, we use data to identify where we think there are issues and gaps. And we use that information to inform policy recommendations. And policy isn't always necessarily hard policy like legislation or regulation. Sometimes that might be modifying community practices or encouraging changes in practices, and not always relying on regulatory. However, we do seem to be regulatory or heavier in our department. We then enforce those laws, whether that's formally through code enforcement or through our practices of assessing and monitoring grantees and community organizations. and just continue to evaluate, and that is kind of the cycle of how public health works and how we do our business at the health department. And sometimes that means things are a little bit slower because we have to take the time to identify, and in places where there isn't a lot of data, we have to make informed decisions based on gathering information in another way. So it's just a little bit of an overview. So I'm going to hand it over to Drew to talk a little bit about risk.
Yeah, so when we met last year, we talked a bit about Anchorage's kind of unique geographic location and demographic makeup that kind of puts us at risk for transmission of vaccine-preventable diseases. 10% of our residents are actually foreign-born. A lot of Alaska residents aren't originally from Alaska, so there's a lot of travel both from the U.S. and internationally. And then also within the state, Anchorage being our big hub city, a lot of communities throughout the state come to Anchorage for services, and then there's the risk of further transmission from our urban center to rural areas. And so in order to be protected against those type of outbreaks, we need to have a high enough level of immunity in the community to prevent that transmission to spreading to the most vulnerable people. So the principle of herd immunity, when nobody's immunized, everybody's vulnerable, outbreaks can occur and spread real quickly. When only a small amount of the population is immunized or immune against these diseases, those individual persons who are vaccinated have protection against the disease, but it's still able to spread against those who are unvaccinated or vulnerable. But when we reach a high enough threshold of the population that's immune, then that spread of disease is contained, and so the children that are too young to receive vaccines and those who have certain chronic health conditions that put them at risk of getting infections and are unable to be immunized, they have that level of protection from the community. We looked at our immunization rates here in Alaska, and we're really not up to where we need to be to provide that level of protection. We kind of focused on pertussis, measles, mumps, and chickenpox or varicella, that these are all respiratory diseases that are easily spread. And so we're, again, not quite meeting those goals that we need to be protected against an outbreak of vaccine-preventable diseases. And when we look at the rest of the U.S., we see we're kind of there near the bottom. This was the data that we presented last year, which was from 2015. And you can see the most recent data, very similar numbers. Improved a little bit in pertussis, the DTaP, and MMR, but not looking good for chickenpox or varicella. And these rates were for children under 35 months and having 4 doses of DTaP, 1 dose of MMR, and 1 of varicella. So that's just kind of like a common benchmark that we use in public health or immunization rates. Is the primary series for children under 3 years old, that they at least get 4 doses of DTaP, 1 of MMR, 1 of varicella. And then just an update on some ongoing activity. Fortunately, since we were with you guys last year, it's been pretty quiet. The mumps outbreak had just came to an end when we presented. There have been no new cases of mumps reported within the state. Still seeing pertussis and chickenpox activity. However, we haven't seen any abnormal outbreaks or clusters. But again, we still have that baseline of some of these diseases are still occurring out in the community. There was one recent case in July where there was an imported case of measles on the Kenai Peninsula. So Peninsula resident had traveled outside of the state and picked up a measles infection, came to Alaska and became symptomatic. Fortunately, it did not spread either in Kenai or elsewhere in the state. And something I do want to note is that we think about these are diseases of the past, or they happen in other countries, not here in the U.S., or that it's not a serious disease. We all got chicken pox when we were children. We're all fine. We actually did have a recent case of varicella encephalitis actually just this last month. So even though generally they're not harmful diseases, they can be really serious. So this person had a brain infection caused by chicken pox and was in the hospital for a number of days. And in the South Pacific, they've got a pretty serious measles outbreak going on in Samoa, American Samoa, Western Samoa, and in fact 15 children have died from measles. And again, as I pointed out earlier in the slide, Anchorage doesn't exist in a vacuum. We've got all kinds of people traveling in and out, and so potential of the spread is significant.
Do you guys have any questions about that before we move into talking about the recommendations? So last year we ambitiously recommended these 4 things. We recommended that that the health department should lead by having our own employees be required to be immunized. That we wanted to review the municipal code as it relates to regulations in child care facilities and of the staff related to those locations. That we would review shelters through kitchen staff vaccination policies, make recommendations, and then review the school district policies as well and make any recommendations. So we're going to go through what we did on all 4 of these, and each one of us have a little bit of different things to add. The staff, Drew particularly, spent a lot of time researching other state policies as it relates to child care licensing, and then we were lucky enough to hire Nicole recently. I don't remember how long it was, like a year, but it's probably just been like a month.
3 months.
3 months. Who also happens to be a child care licensing expert, so we have some things to present to you. So the first one was the health department review. So I owned this recommendation as it relates to making sure that we had protected staff persons. So there's a couple different things I have been learning about that process where I am working with the legal department as it relates to what we're allowed to require staff to do, whether or not we would put a policy in place or do a recommendation. So a part of that required me to look at the police department and the fire department do have policies in place, and in some cases they were able to bargain one thing that they require as a immunization and the rest are recommended. And so most likely, well, I'll go into that the next slide. So I learned about what fire and police do. We also reviewed other healthcare providing organizations, which generally provide only healthcare services. So our department's a little different because not everybody's in the position of providing healthcare services. So we would have to look and make sure that if we're making a policy where something's required, that it's necessary to be applied to that group. So I'm learning a lot about that. So what we are planning on doing is formalizing a recommendation for new staff or L staff that would include a list of recommended vaccines for all employees in lieu of the policy requiring it for all staff. And our chief medical officer has provided us with lots of great insight and input, and we're just reviewing to make sure that the recommendations we're going to provide are the right ones.
Ms. Alzo? Thank you. So would this also somehow work in with contractors, especially if they're in your building or interacting with the same folks that you're interacting with?
Yeah, we would probably make a policy recommendation that they consider it. So later in here we go into some Parks and Rec recommendations where we made a recommendation for MIT and Parks and Rec and people who are volunteering or working with particular populations that might have higher risk of what they should consider being immunized for, or what kind of safety protections they should use.
And one follow-up is there any limitation to this based on funding sources, state or federal funds that would say, no, this is not okay to do?
No, I don't think it's about state law and whether or not there's a reasonableness to require a government employee to be required to have a vaccine, but I'm not a lawyer, but we have one working with us who's making sure that we fall in the right line. What we do have is a clinical policy. So clinical public health nursing staff do have a policy in place that's been in place since the mid-90s. And that's in line with hospitals and the neighborhood health center because they are on the regular basis working with highly vulnerable populations that they could be exposed to those diseases. So what we're committing to doing is exploring that policy. We'll make sure whether or not it applies to contractors, but like we will do, you'll hear about with child care providers as well, is that we're going to be focusing more on the recommendation and educating people about the importance of it and hopefully encouraging participation through that method. And we will update the clinical policy to include any new relevant information. So that's what we're doing with recommendation number 1. I'll turn it over to Nicole for number 2.
Sure, thank you. And so we, right now, by reviewing, we're seeing that there is only one regulation, but other than that, no regulations that require vaccinations for teachers or staff or volunteers. And so the one regulation I can just specify is 16.55.300. Not up there, but I'm just saying it for you. And it's very narrow. Right now on paper, we have one provider that utilizes it, but actually that's a paperwork error. They stopped using that license January of 2019, so this past year, and they just haven't gotten it off the books yet because it was for underuse. And so I can describe a little bit about what makes this very narrow. It's not for all child care providers. It's only for these 2 very specific types of child care providers. So it would be in Providence is the one, a healthcare provider who also then has child care, to have an adjunct room of no more than 8 additional youth who would be able to come there even if they are sick. And so if they were running that room, then they would have those providers have that requirement. That's a level 1. A level 2 is when you have a specification that there needs to be special equipment and or special staff that are on staff, and there are none of these licenses, nor have there ever been in the Muni, where you have to have a nurse on staff for short-term physical disabilities or illnesses. And so special equipment or special staff, no one has ever taken that out because it's a super specialized license that no one has found a need for in the community. So no one is actively using this or needing to have that requirement. Therefore, we're saying no one is required to do this. Instead, what they have, which is aligned to the school district, there's a requirement for the children to provide their immunization records. And then moving on to the next one. While going through this, we did do a survey. We put it out to all of our licensed providers. And so I'll speak a little bit. The issue I would say is that the people who responded, the frontline staff, the people who are sort of that new hire, the people who are doing the majority of the child care, not the administration of the programs, they did not respond. So it's disproportionate. It's not representative of them. If we were going to do more work on this, we would do this differently to get a different result. So that's one thing just to keep in mind. The survey indicates that employers are less willing and able to cover the cost, i.e. to make that requirement of their staff, than staff seem to be. So what I would say about that is 71% of the employers who responded said that they were not willing to cover the cost for this requirement of their frontline staff. But staff who did respond, and again, because it was disproportionate, respondents were people who were administrators, they are most likely going to have that full healthcare coverage from their employer. 70% of them said, I would be willing. If I had a need to be vaccinated, I would be willing to do it. 13% said that they already work for an organization that requires this. So simply because we don't require it as the municipality doesn't mean that each individual provider doesn't have the opportunity to provide that as a requirement of their staff. And then we asked a couple of questions to sort of tease out any of the barriers that may be in place for staff, such as did they have insurance and did their insurance cover it? Do you have transportation issues or do you have medical conditions that would prevent you from being vaccinated? And what we see is that there were no gigantic barriers from the people that we were able to get answers from. So again, if we were to move forward with any other thing than what we're doing, which is our recommendation on the next slide, we would need to then resurvey our workforce. And from all of that, what we are saying is that we're not recommending a requirement in code, but we're going to recommend some education and communication about this topic. And what we're going to say is we're going to strongly recommend it now and in the future make a requirement to educate this willing population and to target the right population. And what I would say about the right population is the providers who are providing care to infants or children of less than 3 years old, right? Because then they're not going to be immunized themselves. Otherwise, that herd immunity is going to come from them. I'm sorry?
Oh, sorry, question on that.
Yeah.
How many providers specifically in that group do you believe are not vaccinated? Or what percentage? Any idea?
I couldn't speak to that at this moment in time, but if you're very interested, I can try and get you some rough sketch estimates, but I couldn't do that accurately right now.
Okay, thanks.
Are you interested?
Well, I would, yes.
Okay.
Just to gauge
Sure.
the gap.
Right. So again, what I would say is that we want to make something that's equitable and we want to make it easily enforceable. So what we are going to recommend now and then in the future require is that the health department will provide some materials that will be required for all staff who are coming on board to any agency to then have to receive this material, these educational materials about who you're serving, what's the power of herd immunity, why you should get vaccinated. Here's where you could go for that. If you're underinsured or if you are insured, how to ask your insurance agency about that. So some of those materials, as well as requiring information in the parent handbook specify. So right now we already require, because state code requires us to require 18 points that must be identified in parent handbook. So we would then make it 19 points. And the 19th point would be you must state your staff immunization policy so that parents can choose a provider who maybe does that. Maybe that gives them a competitive advantage in one way or another, and then let them sort it out in that fashion. Additionally, we would, as the health department, do outreach efforts with child care providers at their site of location, or if they're ever having like a big retreat day, or if they're going to a conference, we would go there and connect with that population and those staff. Specifically, we would want to, again, be targeting those providers who are serving youth under 3. And we would say, this is the power of being immunized, and here's the ways that you can do it. Here are the access points. Here's how you do it if you are underinsured. And so then, Drew, I'm just going to leave this last part to you just to describe what is a good news in 2020.
Yeah, so currently the state of Alaska, through a federal program, Vaccines for Children, they're able to purchase vaccines at a bulk rate, at a cheaper cost, and they are able to deliver those vaccines to children at no cost to the patients. In Alaska, we have the Alaska Vaccine Assessment Program that kind of supplements that, back off of that bulk contract, which expands it to all children and then to select adults. But in 2020, they're expanding the number of vaccines that they'll be carrying for adults, which is going to include, the MMR and the varicella. and some of these things we're talking about, so that uninsured adults and adults with private insurance, they'll have access again to these vaccines at no cost, because they've already been paid for on the front end by either their healthcare provider who opts into the program, or through their insurance company who pays a fee to the state, so that their covered individuals can get these vaccines. So there'll be a lot less barriers to get vaccinated in 2020 with the expansion of the AVAP vaccines that the state will be providing. So that's we're excited to hear that news, because that will improve access and availability of vaccines to adults.
And that would be, what we would be communicating to them through our outreach efforts.
Do you guys have any questions on this recommendation before we move to 3?
Well, just so I'm clear, is it because of state law primarily because of state law that you've decided to go with a recommendation versus changing code?
I think we're going to propose to change code to make the recommendations related to the materials and adding that 19th point to our code when we bring forward code revisions. We kind of want to we want to get through animal control code first. So as a department, it takes a lot of energy, effort to move code.
2021.
So we have to do them in batches. So because it'll take Nicole, it'll take me, it'll take the team. So they have other things that they wanted to update in their code coming up in the next year.
And I do think that a lot of the providers do look to us as someone who's giving them helpful information. We make recommendations for them to improve their communications with their staff, and they start doing it in advance of the requirement. And so that's where we're saying we can do that now, especially when some of the information is persuasive. Here's where you go to get them, whether you have insurance or not, and you can have it. Right, like that takes away this other aspect, and so we say this is why it's important. You've dedicated your career to this. Keep these babies safe. Go get your shots. Right. So, right, I think that it could fall in line with that, and that we're not going to have to say we are requiring you to provide that paperwork to say that you have it if we attack it in this other way.
And I just will add in terms of the survey results, although not. Has some flaws to it that we might have done differently. There was a lot of willingness reflected, I think, in their responses in terms of wanting to ensure that they were providing safe environments, and a lot of people just didn't even know or remember if they had vaccines, which I think if with some strategic outreach that we can do in the coming years, we can help really close that gap, and I think the majority will happily receive the vaccine or will it verify for them. So it's sort of just increasing the education. I think we can increase the compliance.
Thanks. So number 3 is on shelter supervision review. And Lily's gonna
So last year we proposed to review and work with shelters to implement the vaccination policy for the staff, and as well as if we can expect to the guests, that would be great. And so far what we have done is reaching out and have some communication with shelter, and we found that they were very eager to learn that what they can do to keep the staff as well as the guests safe and free from vaccine preventable diseases, and also work on infection control within the facility. So we have previously worked with shelters to implement public health week where we're testing for TB, offering flu shot and various STD tests. But since we met here last year, we worked in hand-to-hand with shelter and also other organizations like the State of Alaska and CDC, United Way and United Way to come up with an infection control manual or recommendation that every shelter can apply within their facility. So that's the link for the reference guide. Is actually go through everything between recommendation for infection control, which is wash your hand every day or cover your cough or clean your surface, to this is what you do if a staff or a guest is sick. This is your isolation protocol. These are symptoms to look for. And this is when you contact a provider or call 911 or call the health department if you have questions. To also recommending immunization for vaccine preventable diseases. And a little bit before we started this work group, we were seeing a couple of activities surrounding not just tuberculosis, but varicella and folks being discharged with something they can potentially pass on to other guests. And they were discharged to shelter and they were staying in a respite area. So already the shelter staff and guests did have questions about how do we handle and manage these sick people who can potentially pass this on. And then and we're having 200 plus people a day. How do we control that? So this was really a good starting point, or a very good way for them to learn how to manage this condition. What we also learned during this, the formation of the work group, was that there was nothing nationally already available for shelters. We were really leading with that work group and putting together a manual for guidance for shelters. So it was really a big thing that the CDC folks really took the lead on, because they wanted to make it available for the rest of the United States and even Canada. They researched even just find out if in Canada there was something already available. So in addition to that, we also developed a formal recommendation and training for camp abatement workers. We have learned that almost every summer the city was working to clean up camp, and we were concerned about not only the safety of folks staying at the camp, but also the safety of the folks who were going in the camp to clean it up. And what we did was that we developed a training curriculum that included technique for picking up dirty needles and disposing of them, protective equipment, even having the right shoes, how to clean them off when you're done so you don't bring those potential germs at home and infect your family, hand washing technique, and also basically personal disinfection when you're done with your work during the day. And we also recommended immunization because, again, like Drew went over our rates on respiratory diseases, there was a potential that their workers could be exposed to a number of those diseases while they were working through camp. So we recommended that they be immunized against measles, mumps, rubella, hepatitis, and varicella. So during both of these, we also, I'm going to talk about it in the next slide. More training. Here's the next slide for that. And so we provided the training, we immunized folks during our training for shelter abatement, but we also work with several agencies on the Project Homeless Connect. Historically, we've been going to the Project Homeless Connect to provide rapid hepatitis C and HIV tests, but we've heard last year that there was a national outbreak of hepatitis A amongst homeless individuals who were men who have sex with men or IV drug user. And because of that national outbreak, and to work in the prevention effort, the state have expanded the current vaccine assessment program to immunize the high risk. So in view of that, we have expanded our activities at the Project Homeless Connect in 2018 to include also vaccination of hepatitis A and flu shot for those who have not had it by then, since it's in January. So we were able to give a number of folks hepatitis A vaccine and flu, and then we also continue with the HIV testing and hepatitis C, and added some syphilis testing as well, because we're also having syphilis issue currently in the community. I'll go to the next slide. So this slide is basically a summary of what I've said, in addition to what we routinely do, which include disease investigation, screening, testing. Again, the minute we hear that there's a disease, there's a confirmed case of any type of disease or vaccine preventable disease, we follow up and make sure that anyone else who was exposed get the care they need. So we continue to work in developing with shelters and to develop a policy. And we also, in addition to the infection control, we work separately to develop a policy for tuberculosis screening and cough etiquette. So folks at shelters know when to really be to watch out for TB symptoms and report them early before it's too late and other contracted disease. So we continue to advocate and strongly recommend vaccines for volunteers and at shelters, or whether they should also go to camp or in the MIT team. What we are looking at is implement existing electronic system to be able to track those who have already received the services we are offering. Some of those systems as the Homeless Management Information System, HMIS, and VacTrack, which is our state database for vaccine tracking in Alaska. And also inside is our medical record, and the vertical change system is the new surveillance system that the state has recently acquired to continue the surveillance of infectious diseases. So the goal is for us to utilize this system, have folks that are already registered in immunized or accessing health services, and those who have not had those opportunities, we wanted to be targeting them and providing specific outreach so we get the most amount of folks immunized or at least have access to health care.
So I'll wrap up this one just because I didn't put on this slide and really addressed all of the things we are working on. So when we left this meeting last year, we recognized that if we were going to work on shelter policies, we needed to look at the Anchored Home Plan. And so the public health team actually really deep dived into that plan, and we formally communicated to the coalition and to the mayor's office of our desire for the third pillar to actually include public health as a priority and include 4 very specific actions. 2 of those are put here, and we are still working through some of them and being able to we want to be able to collaborate closer. These were never amended and put into the Anchored Home Plan, but included in it was all of the training and safety recommendations for volunteers and workers related to homeless camps. So the team actually did quite a deep dive, looked at national best practice and policy around working with people who experience homelessness, and felt that the public health portion, while it's mentioned, the word public health is used a lot, the actual components of concrete public health aren't included in it. So we continue to follow up on those, and we'll continue to work to get the things that aren't checked off in the future.
We have a question from
Yes.
Mr. Rivera. From Ms. Elto.
Thank you. Can I get copies of the documents kind of referenced here, especially as I'm working on some other regulatory things, so I can guide my work, and that letter?
Yeah.
Awesome, thank you.
So slide 4, or the recommendation 4 was about reviewing school district policies. Are you?
Yeah. We felt that like Nico mentioned earlier, that children who are entering the school district have a very robust vaccine requirement, and because most of them are immunized appropriately or have an appropriate exemption, it posed the schools in general as a low-risk assessment. So we didn't focus a lot of our effort in requiring staff from the school district or making a policy recommendation for them to be immunized. However, we have worked in partnership to increase the access to immunization. Namely, we have worked hand in hand during this flu campaign to provide a high number of flu vaccines. Like Natasha mentioned earlier, we have currently provided 3,830 flu vaccines, and through 36 immunization sites, and 25 of those immunization sites were schools. So we're very confident that a lot of children and staff at school have received the flu shot this year, those who wanted to, and they have not only worked with us to get those vaccines available, but the school nurses at the Health Services are continuing to promote that immunization campaign among the staff. And we're right in the middle of our flu campaign, so we have 10 more school left to go and continue our immunization efforts. And of note is that this time last year, we have provided 984, so that is a lot more flu vaccine that we have provided this year. But we're continuing to work with the school district health service to promote and advocate for immunization among the staff as well as the children. Next slide.
Yeah, so the next steps, oh, you got a question?
Can I make just a quick comment? I want to say that putting the papers up at the school totally gave me cachet to get my kid to get the flu vaccine. I was like, look, the school recommends you do this. Because she resists it every year because she doesn't want to. I'm like, no, the school says. Because that's way more authority than I ever have. So I appreciate those flyers very much.
We gotta do what we gotta do. So here's our next steps that we're committing to. That's on my end. We'll get a recommendation and policies cleaned up at the health department. As we talked about, we'll develop those provider resources for the child care facilities, bring forward the changes in the code regarding those recommendations when the time comes for that. And we'll continue to develop capacity with homeless shelters, with Parks and Rec, MIT, and any of our community partners, and continue our partnership with the school district. That's where we are. And that is it.
Any questions from members?
So yeah, all you have to do is finish that animal control.
Just
kidding.
Well, I do have a question about the camp cleanup training. It's been about a year. Was it since 2018?
Well, we did it in 2019.
2019.
The spring was our first time.
First time. And the training is completely conducted by your department?
Yes.
So that's a new thing.
It is a new
You've
thing,
taken on.
and I believe, I didn't actually participate in it, but I think Shannon Davis, who was one of our nurses, worked with Parks and Rec and went to, he had a regular, a training for the team that goes out and does that work. And then we added, and we have I'm not sure if what I have is the most current version of all the things we did, but it was safety, proper protective equipment, how to handle biohazards, how to be aware of contagious elements, standard precautions for needles, other pathogen information, bloodborne pathogen training, I think de-escalation training. There was a bunch of stuff that we recommended, and then also providing vaccines themselves. So I think they did 111 vaccines for Parks and Rec staff, shelter staff, and MIT, right?
Mm-hmm.
And I think I heard that until the Anchorage Health Department brought up the issue of a reference guide for infection control, there was nothing nationwide, and you booked it from Canada.
Yes. So what happened is the homeless population was experiencing group A spread outbreak and among other disease, and that was a rare type that was not seen anywhere else in the U.S. So the CDC was very involved, and then that sparked the idea of what do we do in terms of infection control. So we started looking nationally at what the other city or state do for infection control at shelters, and we couldn't find anything national. We actually asked the CDC to look up for research, because we thought they would be the one giving that guidance, and they couldn't find anything at all nationally. And I think we look at Canada's as well. I think they found something very limited in one of the counties in Canada, but nothing very comprehensive like what we came up with.
Wow. Well done at leading in that area. Impressive. Okay, any questions or comments from anybody? Thank you so much for this follow-up presentation and helpful information. Really appreciate all the work you've been doing. This is very important work, and I'm grateful that you're doing it. If you want to stick around, since we have such a small group, we're at C, other business, and I don't think we have anything else. But we'll go straight to audience participation. If there's anyone who wants to speak, or perhaps if you have a question too, it would be okay to ask it now. Is there anyone here who would like to speak?
I was glad to hear today that this committee time is changing. I've had a conflict with another commission that I attend as a
identify yourself for the record one more time?
Donna Mears, M-E-A-R-S, Chair of the Health and Human Services Commission.
Thank you. Thanks for being here. Look forward to more collaboration. Is there anybody else who'd like to speak? Well, again, thank you so much for the presentation and your time. We are adjourned.